A 20 years old lady referred to Vascular clinic. She has feeling generally unwell for past few weeks. She works a typist and she has noticed increasing pain in her forearm whilst working. On examination, she has absent upper limb pulse. Her ESR major and mildly elevated. What is the diagnosis? So we have to find out diagnosis in case of 20 years old lady who increasing the pain of the forearm while working, and there is the absent upper limb pulse. So this is most important, that absent upper limb pulse and ESR increases. What are the options? Here the options are polyarteritis nodosa, granulomatous with polyangiitis, giant cell arteritis, Takayasu arteritis, and Burzer's disease. First of all, let's see the Takayasu arteritis. In case of the Takayasu arteritis, it is the inflammatory condition and it occurs obliteration arteritis affecting the aorta and its branches. Female are more affected than that of the male, and symptom usually the upper limb claudication, that means the upper limb pain. And the clinical findings is the diminished or absent pulse and ESR increases. So this two is the most important point for diagnosis of the Takayasu arteritis. One of them is the diminished pulse or absent pulse, and second of one, the ESR is increased. And the Takayasu arteritis may be divided into acute systemic phase and chronic pulseless phase. So the Takayasu arteritis, it has two phases, acute phase and chronic phase. In the later part of the disease process, the patient may complain symptoms such as upper limb claudication, which is present in this patient. Later stage of the condition, the vessel will typically show signs of intimal proliferation together with band of fibrosis of the intima and media. So what is our diagnosis? Our diagnosis is the Takayasu arteritis. Why Takayasu? The diagnostic point of Takayasu arteritis is the absent upper limb pulse and ESR mildly increases. Other options here such as the Burzer's disease. The Burzer's disease, it present in case of the lower limb. Giant cell arteritis. Giant cell arteritis usually present with a headache. And vision loss and vision involvement. Granulomatosis, it is also not true, and polyarteritis nodosa, it is also not true.